The final order of discipline, according to the proposed recommended decision that's going to be made to the full board, based upon the foregoing findings of fact and conclusion of law, the panel recommends the following order of discipline. Number one, it is recommended that the North Carolina medical license of Dr. Rashid A. Buttar be indefinitely suspended. This suspension is hereby immediately stayed upon the following conditions. So they want to immediately and indefinitely suspend my license and then stay that immediate suspension as long as I follow the following 3 rules or criteria that they've set. That Dr. Buttar shall not use hydrogen peroxide as a treatment modality. That Dr. Buttar shall not treat any cancer patients whether they had cancer in the past or cancer currently, or they are diagnosed with cancer once Dr. Buttar starts treatment. And C, Dr. Buttar shall not treat children less than 18 years of age. This, of course, the deal that they proposed in order for me to not go forward with the next step that we were going to do, which we are going to do, which is depose the medical board attorneys and the medical board panel. They don't want this to get out, so what they said was that basically they would drop C, in other words, let me see children up until November or I'm sure that they would come after me again for something that they would trump up, and that they would also not suspend my license, but just require that I not see any cancer patients anymore. The problem is that in B, the stipulation says that Dr. Buttar shall not treat any cancer patients whether they had cancer in the past or cancer currently, or they are diagnosed with cancer once I start treating them. So that means that every one of my cancer patients that's currently on a maintenance program, that has defied the odds, that has already failed everything that everybody else could do for them, and that we have been able to help, that I would have to agree to stop treating that patient, that I would have to basically condemn these people to a most certain death because I could not continue doing any type of maintenance on these people. And that is simply something that I cannot do. I will never make a deal with the devil. I refuse to make a deal with the devil. You see, the problem is that I've taken 2 different oaths. One of those oaths was the Hippocratic Oath, and the other oath was as an officer in the military. I will read to you the oath that I took as an officer. I, Rashid A. Buttar, having been appointed as an officer in the U.S. Army under conditions indicated in this document, do accept such appointment and do solemnly swear that I will support and defend the Constitution of the United States against all enemies, foreign and domestic, and that I will bear true faith and allegiance to the same, that I take this obligation freely without any mental reservation or purpose of evasion, and that I will well and faithfully discharge the duties of the office on which I am about to enter, so help me God. Now, it's interesting that about 230 years ago, one of our forefathers, Thomas Jefferson, made the statement that I've read earlier during this taping, and for those of you that haven't heard that, I'll repeat it, that if people let government decide what foods they eat and what medicines they take, their bodies will soon be in as sorry a state as the souls of those who live under tyranny. It's amazing to me that whenever I read some of the quotes from our forefathers, that they had the insight to know 200, 250 years later the types of trials and tribulations that we would be faced with. I've taken an oath to defend my country against all enemies, but this time the enemy is not across the ocean. This time the enemy is not threatening our borders. The enemy is already among us. I've written this as a email that will be sent to anybody who decides to opt into this website so that we can keep you abreast of all the information. And the information that I wrote, and I'll just read it. The enemy is amongst us and it threatens the very fabric of existence by mandating how we take care of our own bodies. And it begins by using the pawns of the medical board and various other governmental agencies and regulatory bodies to prevent the masses from seeking out the truth that can make their bodies healthy and strong again. It is my children that I fight for now. It is my patients that I fight for now. And in this quest, we will always be protected by God Almighty. I thank you for the time that it's taken to listen to this long information, long and detailed information. I encourage you to look at all the resources and all the references on this website if you still aren't convinced of what the truth is. But most importantly, I would like for you to put your email address and your name down so that we can continue to let you know what's happening. I hope that you do speak out. I hope that you take the time to enter in your comments in the blog that's been provided so that we can let the world know what is happening and the fact that you are not willing to tolerate this. I certainly am not, and I know that many of my patients, in fact, the vast majority of my patients, are absolutely enraged by this. But there are many other doctors too that are upset about this and that are threatened that if the medical board comes after me or any other doctor that's doing this type of therapy, that they would be next in line, and it scares them and it prevents them from having to be able to provide the type of care that the patient needs because they're scared that their license could be threatened. That is not the right way for a doctor to practice, to feel that they're threatened, that their license could be taken just because they're doing the best thing for the patient and that the patient has requested. It is not the right way to be practicing medicine. So I hope that you take the time that's necessary to let other people know about this website too. And I appreciate your well wishes and your intentions and your prayers that many of you have sent. It means more to me than you'll ever imagine. It actually makes it all worthwhile. It makes this fight very much worthwhile, knowing that the people that I've helped and the people that that care about what we're doing and how we're treating our patients, that it does make a difference to them, and that they are willing to voice out how they feel and give us the support in their prayers and in their intention that we've asked for. So I appreciate that. And for those of you that have any other interest in anything else that we do, we have a number of resources below that you can get further information regarding the fight against the North Carolina Medical Board, for the North Carolina Integrated Medical Society, for the Carolinians for Healthcare Access, which is a patient advocacy group that's been put together by a number of my patients and other doctors' patients that are enraged by the atrocities committed by the North Carolina Medical Board, as well as other resources for more information, including the medical series DVDs and, of course, our clinic website that can give you more information on what type of services we provide. I thank you for your time again.